first came to the Virgin Islands, we didn't have a public health nurse on St. John. The clinic did everything.
The Virgin Islands basically had a plan that said an individual, an adult, must have an income of $5,500 to be eligible for Medicaid. Now what happens is that someone who's making $5,500 wouldn't necessarily have any record of that. That means they almost would be destitute. So there are a lot of families who make more than $5,500, less than $20,000, that still cannot qualify. So our eligibility requirements don't even take into consideration the federal poverty guidelines. So that means so many people are basically ineligible.
A health disparity in and of itself is a difference in health access or health status for one group of people versus the average American. So for the Virgin Islands, disparities exist in funding to begin with. Not having Medicaid like the states do, and having it capped and having a 50-50 match is a great disparity for us. It does not allow us, our residents, to have full access to all of the healthcare services that other people with Medicaid have access to.
What I've learned in all this work, and there's been national studies to prove it, the longer you delay entry into medical system for care, the worse the outcomes. The National Institutes of Health basically did like about 4 studies, but the one that I was interested in was called Too Little, Too Late. They studied Americans between the ages of 18 and 65 adults and analyzed their health outcomes based on whether they had insurance. People, their chronic disease worsened, and many of them died a premature death.
Public health, I think, if you look at it from the standpoint, it is preventive. It's not hospital acute care. It is prevented. It is long-term in the community.
There's a fair amount of depression that is probably unrecognized and untreated. But hypertension and heart disease are, big for us. The leading cause of death in the Virgin Islands, as in the United States, is heart disease. Second is cancer. And I think we have high rates of cancer. We have a lot of prostate cancer and a fair amount of breast cancer. So that's the second leading cause of death. And the third is stroke. Diabetes comes in very close. It's probably around 5th or 6th. Not to mention HIV and AIDS, where we have the second or the third highest incidence cases of HIV AIDS per 100,000 in the country.
What do we really want to do in the Virgin Islands about trying to improve access for our community? And my experience with VIPI has showed me that we have lost a number of individuals because the chronic disease had lapsed into conditions that really were hard for people to basically revive from.
The program I would like to see them put back again is the public health nursing program, which is virtually non-existent in the Virgin Islands now and would solve many, many of the health problems that we have.
We probably could train some more providers. We absolutely need more nursing. We were able to amend the healthcare reform bill to include community health worker grants, and I think that would be a real good asset, especially in some of the communities in the territory where people from within that community will be trained to educate and to support persons who have different kinds of illnesses.
One thing that we really need to do is to really consider adapting the primary health care model. The federally funded clinics, one on St. Croix, Frederickson Healthcare Center, the one on St. Thomas Medical East End, are federally funded, and they also subscribe to the primary health care model. There are the 3 main specialties of healthcare: internal medicine, pediatrics, and OBGYN. You come in, you get registered, you do your first assessment, you do your screening, you do your diagnosis, and there is a record kept for you. You basically look at all the outcomes of your diagnosis, and then you get the treatment. So you basically kind of develop a medical profile, and you actually have a medical home where you know your providers. You know your physicians, you know your nurses, you know your social workers, you know your community outreach workers. They all know you, they know your family, they know your medical history, and so this way there is a bond and there's a link between your medical home and you and your family.
We do a maternal and child health clinic once a month on St. John, and I would be willing to bet that 90% of the clients that come to it do not speak English. We do not have interpreters within the health service. The people who they use as interpreters, when they tell you that they have them, are the housekeepers, the kitchen workers, somebody's 12-year-old child that came with them, all of which are totally inappropriate. There are laws, there is funding available, but if you accept federal funds to do with health care, you are supposed to provide interpreters. And it's not only frustrating, it's downright dangerous, both for the client and for the provider.
When we have a higher percentage of uninsured than the nation does, being able to access insurance is critical for us. And we will not be able to cover up to 133 or wherever we end up, 38% of poverty with Medicaid. So we'll have a lot of people who need insurance. The exchange provides not only a marketplace where you would choose your insurance, but it also, once it's set up, subsidies to help lower income individuals and families be able to pay their insurance premiums.
I think we have to be very realistic about the fact that we have a lot of people here who don't qualify for any service that there is provided. And we need to budget that. You can't put your head in the stand and say, well, they shouldn't be here. All right, so they shouldn't be here, but they are here. And it's like our midwife says, with the prenatal care, you are actually investing in a United States citizen, so let's get a good one. Because those babies are going to be born here, even if the mother shouldn't be here legally.
I went to a hearing where we had someone ask a question of the Hospital Association and other associations, and all of them said, American Nursing Association, territory should be treated equally. Americans living in territory should be treated equally, like anyone living in any of the states. So we've gotten some support, and the more we get, the better it is for us. And the support doesn't end when this bill gets passed. It can't end.